Top 10 signs of diabetes you can see. Doctor explains, did you know that your body might already be showing signs of diabetes right now, and you may not even realize it? In fact, 1 in 4 adults with diabetes are completely unaware they have it. And that's dangerous because untreated diabetes slowly damages your nerves, organs, blood vessels, and even your immune system. But here's the good news. Many of the early warning signs are visible on your skin, hands, feet, and even your face. In this video, we'll break down the top 10 visible signs of diabetes you can spot in the mirror, so you can take action before it's too late. So, what exactly is diabetes? It's a condition where your body struggles to regulate blood sugar. Normally, a hormone called insulin helps move sugar from your blood into your cells for energy. But in diabetes, either your pancreas stops making insulin or your body becomes resistant to insulin. The result? Sugar builds up in your bloodstream, and over time, that excess sugar damages your nerves, blood vessels, and tissues. Since type 2 diabetes is the most common and often goes undiagnosed for years, that's what we're focusing on today. Number 1. Acanthosis nigricans. Have you ever noticed dark, velvety patches on the back of your neck, armpits, or groin area? This is called acanthosis nigricans, and it's one of the earliest visible signs of insulin resistance. As your insulin levels rise, it activates growth factors in your skin, especially in areas with friction causing thickened, darker skin. If you've noticed this, it's time to get your blood sugar checked. Number 2. Skin tags. These small, soft, hanging flaps of skin usually show up around the neck or underarms. While they're common, having multiple skin tags can be linked to high insulin levels and prediabetes. Think of them as a red flag from your body saying, something's not right with your metabolism. Number 3. Frequent skin infections. Diabetes weakens your immune system and feeds bacteria and fungi literally. High blood sugar is a feast for microbes, which is why diabetics are more prone to boils or abscesses, fungal rashes, especially in warm, moist areas, persistent itchy skin. If your skin is constantly irritated, infected, or slow to heal, it may not just be your hygiene, it could be your blood sugar. Number 4. Slow healing cuts. Let's say you get a small cut on your leg. Weeks go by, and it's still there. That's not normal. Diabetes reduces blood flow to your limbs and weakens the immune response, slowing the healing process dramatically. This is especially dangerous on your feet, where unnoticed cuts can turn into ulcers and, in severe cases, lead to amputation. If your wounds take longer than usual to heal, that's a major red flag. Number 5. Blurry vision. Can you read this text clearly? If your vision fluctuates or feels foggy, don't ignore it. High blood sugar causes fluid to shift into the lens of your eye, temporarily changing its shape and affecting focus. Over time, untreated diabetes can damage the retina, leading to diabetic retinopathy and even blindness. Also, dry eyes or eye strain may indicate nerve damage in the tear ducts due to elevated sugar levels. Number 6. Neuropathy. This is one of the most common complications of diabetes and often goes unnoticed. If you frequently feel tingling, numbness, burning sensation, pins and needles in your feet or fingers, it could be peripheral neuropathy caused by prolonged high sugar damaging your nerves. And when you can't feel your feet properly, you won't notice injuries, which leads to more infections and complications. Number 7. Cracked heels. Is the skin on your feet dry, cracked, or peeling? High blood sugar causes fluid loss, which leads to dry skin, and reduced nerve function may prevent the sweat glands from keeping your skin hydrated. This can appear as thickened heels, peeling toes, or chronic itchiness, especially on your shins and lower legs. Number 8. Stiff hand syndrome. Try this test. Press your palms together in a praying position. Can you fully flatten them without gaps? If not, you might have what's known as diabetic cheroarthropathy, or stiff hand syndrome. It's caused by glycosylation sugar binding to proteins in your tendons, making them stiff and less flexible. This is one of those signs doctors can catch during a physical exam, and it usually means your blood sugar's been high for a while. Number 9. Especially with fatigue, losing weight without trying sounds good until it's not. In people with uncontrolled diabetes, the body can't use glucose for energy, so it starts breaking down fat and muscle instead. If you're eating normally but losing weight and feeling constantly tired or weak, it's time for a blood test. This can happen in both type 1 and type 2 diabetes, especially in the early stages. Number 10. Frequent urination and excessive thirst. If you find yourself waking up multiple times at night to pee and feeling extremely thirsty all day, this is a textbook diabetes symptom. Here's why. When blood sugar levels rise, the kidneys try to flush out the excess glucose through urine. But as you lose more fluids, you become dehydrated, leading to more thirst, and you guessed it, more urination. It's a vicious cycle. That's hard to break unless the root cause, high blood sugar, is treated. If you recognize even 2 or 3 of these signs, don't panic, but don't ignore them either. The best test for diabetes is the hemoglobin A1C, which shows your average blood sugar level over the past 2 to 3 months. Unlike a random glucose check, it gives a much clearer picture of your metabolic health. A result of 6.5% or higher means you're in the diabetic range. Anyone over 35 or with risk factors like obesity or family history should get tested every 3 years or more frequently if symptoms appear. The good news: type 2 diabetes is often preventable and reversible in its early stages. Here's a quick breakdown. Eat more fiber, whole grains, legumes, leafy greens, avoid sugary drinks and ultra-processed snacks, exercise regularly. Mix cardio and strength training, maintain a healthy weight, and if you smoke, now's the best time to stop. Small lifestyle changes can lead to big results, and you'll feel better in every part of your life. If you spotted any of these visible signs of diabetes in yourself or a loved one, don't wait, talk to your doctor. Early detection can prevent complications and save lives. And if you want to learn more about how your body may be giving you clues about your health, check out our playlist on other signs to watch for, from your skin to your nails to your tongue. Stay curious, stay healthy, and I'll see you in the next video.